Mr. Henry Dacquet became old. He's just 80, 86 now. 86. Not good in health. My mentor to my son is still very healthy and active. As, Laura is Dr. Professor Karanja's daughter, first daughter. And so this is his story. I hope we can have a similar relationship for life. Learn, share, keep, relationship, and serve the next generation. So Military Hospital was established to share our knowledge and experience with juniors and colleagues, and many doctors came to me from abroad. So why not abroad? So we opened 4 military hospitals in other countries. First one was Lithuania in 2009, and Istanbul 2015, Sabah, Malaysia, Sabah 2022, last year, Moscow. Of course, all of them are independent. So whenever they ask me some kind of guidance or teaching, so I share. So very good doctors, very excellent clinical environment in their countries. The management started with 7 people, including me here, and then now we have 750 only in Korea and 3,000 magazine family all around the world. And we imagine trying to make something special with the creativity, not just a copy and copy of copy, copy of copy of copy. So it was not a good attitude. Of course, we made some basic implant system as well at the beginning. We made some kind of usefulness. The shortest, we have a record as the widest implant in the world, shortest implant in the world, and the thinnest, the skinny implant in the world. This was 2006, long time ago. From that time, we tried to make something, and even one patient who cannot have implant treatment with the regular implant systems. So we try to serve, especially with the special design of implants for that patient. That was our mentality. More and more. Now, I can say, now at this moment, Megagen is considered as one of the best, actually, the most creative implant company. Not only implants, but also on the digital aspect. We are working with more than 100 countries, and because of some special design, some useful implant systems, so we became famous in the United States and in Europe. It's much bigger market share than Austin. Still small, but among the Korean implant manufacturer, we are number 1 in the United States and in Europe. So let's go back to the full mouth implant, the rehabilitation. As all of you know, the population is becoming old. That means they are losing more teeth and they need more implant treatments. Edentulation, full edentulation, becoming bigger and bigger, the population wise. And for the treatment of the full edentulation or the implant treatment, one of the biggest obstacles was unloading period. So when I started, I was advised to wait more than 6 months on the upper arch. So it was very painful to us and for the patients as well. So how we can shorten the unloading period? There was many studies. And with the improvement of the implant system and the surface treatment design-wise, then we could start the loading as quick as possible, much earlier than before. And it was the same with our attempts on the implant system. Rescue implant was designed for the immediate implantation in 2006. At that time, in 2006, molar immediate placement was not accepted. But with the bigger diameter of implant and special connections, so we could achieve more than 96% of success rate with with immediate implant placement. So skinny implants for the temporary interim support for the immediate functions. So that attempt, earlier loading, earlier placement attempt was started at that time, and NUH improved the ability and the initial stability, that you lose bone. And Artgate Digital started in 2012, and 2018 Blue Diamond started, and 2022 we launched the RE and the BDC, the next evolution. But this is from article of Professor Karames of Lisbon University. Full arch and partially dentures case, which is more predictable. Full arch seems quite difficult for the ordinary dentist. Success rate, risk factor is much higher at the partially dentures case because of the forced distribution. So when we place Oron X or Oron X, Oron 4, Oron 5, Oron 6, we do cross-arch stabilization. This forced distribution through the cross-arch stabilization is really important because of this, full arch has a less risk factor, less risks. So this is the first advice to you. And this is one of the typical case recommended in the United States. Most popular way of full mouth treatment, FFP1 courses. It's from my friends, Dr. Ashima Soya. He's quite famous for the full arch course. He was from Tunisia. So I asked him to share one of his cases. So this is process of treatments. So initial and smile design, and then this is initial conditions, and then treatment planning on the Artgate, and then on the flap. I don't need to explain step by step. You know almost everything. And he made a stackable guide. This is a stent for the fixation of the base stent. And then remove the two spouts. And then the next step is to make a scale of the bone structure. It's the second stackable guide to make a scale of the design of the alveolar bone. Okay, like this. Then you can see these bony structures can support very beautiful papillary tissues. Then, time to place implants. Select the stent for the implant placement. Okay.